Hi, this is Sarah McClellan with Pixels and Pills in Boston at the DTC National Conference. I'm here with Mr. Paul Stevenson, Mr. Rishi Shah. So guys, tell us, we're going to do a little bit of a three-person interview here, and you guys are going to touch on some discussions from the panel today. Firstly, tell me a little bit about your backgrounds and company, and you as well.
So my name is Rishi Shah. I'm the CEO and founder of Context Media, and we have a portfolio of chronic disease-specific point-of-care networks.
Okay.
I'm Paul Stevenson. I'm with Novo Nordisk. We focus on diabetes. I work on our basal insulin, Levemir.
So this morning, Rishi, you were on a panel for point of care. Do you want to discuss some of the key topics that were discussed this morning? And then also last year you were on a joint panel, I believe. So here we go.
So the point of care panel this year was quite interesting. We talked in part, Bob had a lot of questions around if point of care's ROIs tend to be better than most of the other media out there. Why is it the last to be added and the first to be cut too often? So he challenged the panelists on that question, and we had representatives from Accent Health, PrimeEd, Context Media, and Health Monitor. So the panel talked about it and debated it, and we had some interesting discussion. And I think what we settled on in part were two primary reasons why it's still too difficult for health marketers to work with point of care. And the first was scale. So over the past, I think, 10 years or so, point of care has grown quite a bit, both print and in the digital space. But one of the lingering issues has been scale. Yes, I can get a 3-to-1, 4-to-1, 5-to-1, 6-to-1 ROI from the media, but what good is it if I can only put down $500,000 there? Is the total return worth it? What is the return on time invested for a product manager? So I think in terms of where the industry is right now, there's been a good bit of growth in the last several years. And most product managers now find that if you are in point of care, you can invest significant resources and get significant returns. Most of the networks are complementary. They're not in the same office. And so there's certainly opportunities, for example, in diabetes to be in the endocrinology space and the primary care space. And that's true across the board in the different therapeutic areas. So that was one finding from the panel.
How did you find that the responses from today's panel differed from 12 months ago when you were doing the same sort of panel last year?
Well, last year it was really just Rishi and I up there talking about our experiences and how things have worked out and how it can be a very economical way for marketers to reach our patients in a very contextual space. Because all of us are really busy these days. We don't always, at least men, don't always have our health foremost in our minds. But when we're in that physician's office, and I think our blood pressure sometimes reflects that, and we're sitting there and we're thinking about our health and maybe some things that we should have done earlier to better prepare for that physician confrontation or meeting, that's when we're open to those healthcare messages. And it allows us to act right away. At least for me, when I have something hit my desk, if I can take care of it and get it off the desk right away, that's perfect. And that's really what happens with the point of care messaging. We're hitting a patient as they're thinking about their health care with the opportunity to go right to their doctor and hopefully, if it's appropriate, come out with a script for our product.
Is there anything else you wanted to touch on from, the conference in the last day and a half? Anything that you felt was really, innovative or at the forefront of what's going on within this spectrum?
Paul?
Well, I think a lot of the information around social media, its emergence, has been interesting. I think if anybody had really cracked that code, they wouldn't be here, and they wouldn't be sharing that with all of us. But sometimes having a chance to sit down and think and listen to other ideas really helps us prepare as we go into our planning for next year.
To echo those comments from Paul, the challenge for us all in this industry is to really build patient-centric marketing plans, to think in a patient-centric way. And it's difficult to do that. We're all so busy. It's easy to, make a media plan in a way that's centric to us, right? Easy for us to work with. Right. And at these conferences, all of the different industries that are represented, all the different types of media, it really challenges all of us to think what is best for the patient. And I think it's been valuable from that perspective, just to see the range of things that are being done.
Fantastic. Well, gentlemen, thank you so much for speaking with me today, and hopefully we'll speak to you again next year at DTC.
Thank you very much.
This is Sarah McClellan with Pixels and Pills.